Scrolling through social media, it's not hard to find misinformation about COVID, but it is harder to spot a lie from someone in a position of trust, your doctor.
They could bring particular harm to the public and to individuals. It's very hard to quantify how much harm that they could produce.
A global news investigation found a web of physicians, mostly in Ontario and BC, have been sharing unverified information about vaccine side effects, specifically blood clots and heart inflammation. Some even claimed the shots killed children. Others were accused of issuing falsified medical exemptions for masks and vaccines. All of the doctors except one have an active medical license. On Wednesday, Ontario's Health Minister Christine Elliott urged the province's College of Physicians and Surgeons, the CPSO, to crack down,
including reviewing the licenses of physicians found to be spreading misinformation.
The CPSO says it is. It confirmed there are more than 40 physicians under investigation for spreading misinformation on COVID-19, and 7 have had their licenses restricted or suspended. Politics professor Wayne Petrozzi says Elliott's call to action, though, is meaningless.
There's a limit to how much they have to listen to you.
In BC, the College of Physicians and Surgeons has refused to release the number of complaints it has received in relation to the pandemic.
They need to put in place a much more robust framework of openness and transparency with respect to not only the activities of the associations, but the decisions they make.
Health and law policy expert Trudeau Lemons says historically, these agencies have not been proactive, but notes imposing too much government oversight could also be problematic.
An excessive level of policing that, for example, would lead them to interfere with normal debate within the medical community.
A fine line, experts agree, needs adjustment. The status quo, they say, leaves patients and the public vulnerable. Jamie Mauracher, Global News, Toronto.